Knock, knock. Hi, Mike. My name is Kieran. I'm gonna be your nurse today. The doctor has ordered a Foley catheter to be put in, and so I was going to come do that if that was okay with you. Awesome. First, I'm gonna start by washing my hands. Mike, can you tell me your first and last name and your date of birth? Perfect, that matches the information that I have on my end. Do you have any allergies that I need to be aware of? No allergies? Perfect. You'll want to make sure that the reason we're putting this catheter in is appropriate. So whether the patient's experiencing urinary retention, if they're going in for surgery, whatever the case may be, I need to make sure that it's appropriate for my patient. So sounds like you're having a little bit trouble urinating since you've had your surgery. So we're gonna put this catheter in. It'll be a sterile procedure, and you'll be good to go. So are you in any pain right now? No? Okay. Gonna wanna start off, you wanna always maintain privacy with the patient. So I'm gonna pull his gown up here, keeping him covered. I just wanna look at his bladder. I'm just gonna feel. It does feel a little large, so that tells me that there's urine in there. You can do a bladder scan if it's indicated, just to get an idea of how much urine is actually in there. But since this catheter is going to stay in place, I'm not gonna worry about that step. Mike, do you have any reason that I wouldn't be able to lay you flat on your back? No? Okay. I'm gonna lay you down. All right, now that Mike is all the way down, I wanna put this railing down just so I have a bigger space to work with. All right, Mike, I'm gonna uncover you here. You wanna help the patient kind of flex their knees. So I'm just gonna help Mike do that. The first thing that we're gonna do is just standard peri-care. So I'm gonna put clean gloves on. I'm gonna expose the patient, and then you wanna just have your peri wipes and do standard peri-care. So you would do around the tip once, throw it away, back one step, throw it away, and then back another step, throw it away. You can also go down the shaft on one side and then down the other shaft and throw it away. Once that step's done, take your clean gloves off, wash your hands, and then you're ready to begin your sterile procedure. Okay, I have my Foley catheter kit. I'm gonna start by opening this. So you wanna open away from you. I'm gonna take the first drape out of the kit. You're gonna wanna put shiny side up. You're just gonna lay this down. Then I'm gonna put my sterile gloves on. And then turn around, throw this in the trash can. Now I'm sterile, so my hands need to stay above my waist, and I cannot touch the 1-inch border around this paper. There's another drape in here. This is what we call the fenestrated drape because it has a hole in it. So I'm gonna lay this over Mike, being careful to not touch anything that is not sterile. Now I wanna set everything up. So you have iodine. This is why you need to assess for allergies. A lot of patients are allergic to iodine, so you wouldn't want to use this if that was the case. You have lubricant, and then you have the syringe that you're going to use to inflate the balloon on the catheter. There's also a specimen cup in here if you needed to obtain a urine sample while inserting the catheter. So, want to start by taking your tongs out, and you have cotton swabs. You're going to soak these in iodine. So since I'm using a mannequin, I don't want to put the iodine on here, so I'm just going to simulate dumping the iodine over my cotton swabs, and then this would go in the trash. Once my cotton swabs are soaked, I'm going to want to open my lubricant. Maybe. And then I'm going to just squirt this into my tray here. Same thing, make sure my hands are above my waist, goes in the trash. Now, I can take this tray out, which I'm gonna do, and then I want to grab the catheter that's going to be inserted, and I'm gonna stick it into the lube. I'm gonna keep it covered for now until I'm ready to go. You have your syringe. You wanna pre-hook this up to the port that's gonna fill up the balloon, because you're gonna be down to one hand once you put this catheter in. So take the cap off, hook it up to the port, and then you're good to go. Now, I'm gonna take this whole thing, I can touch all this, and I'm gonna place this in between Mike's legs. Now, we're ready to begin. I am gonna take this cover off because like I said, you're gonna be down to one hand and it'll be rather difficult to do this with one hand. You wanna stick your catheter in the lube. This gets thrown away. Okay, so you're gonna wanna take your dominant hand and you're gonna wanna hold the penis. Once I touch the penis, this hand is no longer sterile, so I cannot take this hand off the penis. Now you're doing everything one-handed. So you're gonna take your tongs, you're gonna grab your iodine-soaked swabs, and you're gonna clean the tip, and then throw it away. Grab a new swab, clean back a little, throw it away. New, back a little, or throw it away. You do have two left. Since my hand's already here, I'm not gonna use them because I can't lift this hand up. So now that we're done with that part and he's all clean, we're ready to insert the catheter. So you're gonna wanna grab the catheter, make sure that the tip is all lubed up. You wanna make sure that the catheter doesn't touch anything that's not sterile. So I like to grab it like this and I have a firm hold. Okay, Mike, you're gonna feel some pressure. Just take a big deep breath in and then let it out. You're gonna insert the catheter until you get urine return. Once you have urine return, then I can take this hand off, stabilize the catheter, and inflate the balloon. Once the balloon's inflated, disconnect from the port, pull on it, and it doesn't come out. Now you're not sterile. So I can touch whatever. You're gonna wanna secure the catheter bag to the inside of the leg, making sure that you have some slack. So probably like right here, and then you wanna make sure that this bag stays lower than the bladder. All right, and then I'm gonna clean up my area. So I'm gonna hook this down here on the side of the bed, throw away all my supplies. I'm gonna take my gloves off, cover Mike back up, do hand hygiene. Mike, are you doing okay? Perfect. I'm gonna provide any education. So now that he has the catheter, I don't want him to get up by himself. I want him to have help. I want him to tell me if he has any pain, if he feels any pressure in his bladder, if it starts to burn, things like that. Mike, do you want to sit back up? I'm going to sit him back up, make sure he's comfortable. I'm lowering the bed to the lowest position. I'll make sure the side rails are up, make sure that he has his call light, his bedside table, and then I'm going to go document.